Picture this. You are 67 years old. You are retired. You have a comfortable life, a spouse you have been with for 40 years, adult children who call on weekends, grandchildren whose faces you know better than your own. Your memory is not what it was. But you told yourself that was just getting older. It started small. You walked into rooms and forgot why you went there. You called your son by your other son's name. You misplaced your keys and found them later in a drawer that made no sense. You laughed about it. Everyone laughed about it. Then your spouse started noticing things you had not. She noticed you asked the same question 3 times in one conversation, not because you forgot the answer, but because you had no memory of asking. She noticed that you got confused driving home from a supermarket you had been visiting for 20 years. She noticed that sometimes you looked at her with a blankness behind your eyes that was not tiredness. She asked you to see a doctor. You did not want to go. What would a doctor find? You were fine. You were just getting older. Everyone forgets things. But you went, mostly to stop her worrying. The doctor ran some tests. A cognitive assessment, a series of questions and tasks that seemed almost insultingly simple. Draw a clock. Remember these 3 words. Count backward from 100. A brain scan. Blood work to rule out other causes. A few weeks later, you are sitting in the neurologist's office. She says the words, Alzheimer's disease. She says early stage. She says there are medications that may slow progression modestly. She says the word progressive, which means it only goes in one direction. She says there is no cure. Your spouse is holding your hand. You look at her and you think, I need to hold on to this moment. I need to remember exactly how this feels, exactly where we are, exactly what she looks like right now. And somewhere in the part of your mind that still works perfectly, you understand the cruelest dimension of your diagnosis. The disease that is going to take you will take your memory first, including this moment. Before we go through what comes next, and what comes next is going to take years, not months, let us clear up a few things first. I will say a common belief about dementia, and you decide, true or false. Myth 1. If you forget things regularly, you probably have dementia. False. Normal aging causes forgetting. It causes slower retrieval, more tip-of-the-tongue moments, difficulty managing multiple streams of information at once. The difference between normal forgetting and early dementia is not how often you forget. It is what you forget, and how, and in what pattern. Forgetting a name and remembering it later, or when prompted, is normal. Forgetting that the conversation happened at all is not. Misplacing your keys and retracing your steps to find them is normal. Finding them in the refrigerator with no memory of placing them there is not. The distinction matters because unnecessary fear drives people to avoid getting evaluated. And avoiding evaluation in the early stage is one of the most costly mistakes you can make. We will come back to why. Myth 2. Dementia only affects people in their 80s. False. The risk of Alzheimer's disease does increase sharply with age. It roughly doubles every 5 years after 65. But approximately 5% of people with Alzheimer's disease develop it before the age of 65. It is called early onset Alzheimer's. People in their 40s, 50s, and 60s are diagnosed every year. Dementia is not exclusively a disease of the very old. Myth 3. If your parent had Alzheimer's, you will get it too. False. Having a parent with Alzheimer's disease roughly doubles your risk compared to someone with no family history. But doubled risk does not mean guaranteed outcome. The majority of people with a parent who had Alzheimer's do not develop it themselves. There is one gene variant, ApoE4, that significantly raises risk, but carrying it is not a sentence. Many people with 2 copies of this variant never develop the disease. Myth 4. There is nothing you can do to prevent dementia. This is the most damaging myth of all, and it is false. The 2024 Lancet Commission, published in The Lancet, one of the world's most respected medical journals, concluded that up to 45% of dementia cases worldwide are potentially preventable by addressing 14 specific modifiable risk factors across the lifespan. Nearly half of all cases. Not through pharmaceutical drugs, through lifestyle. We will return to this at the end of the video, because it is the most important thing in it. For now, let us talk about what dementia actually is, why it eventually kills you, and what dying from it actually looks like, from the inside. Dementia is not a single disease. It is a term for a cluster of symptoms, severe enough to interfere with daily life, caused by progressive damage to brain cells. Alzheimer's disease is the most common cause, accounting for 60 to 80% of all cases. Vascular dementia, caused by reduced blood flow to the brain, is the second most common. Lewy body dementia, frontotemporal dementia, and mixed dementia account for most of the rest. What they share is this: brain cells die in patterns, in specific regions, progressively and without reversal. And as those cells die, the functions they controlled disappear. In Alzheimer's disease, the process begins with two proteins that malfunction over decades before any symptom appears. The first is beta amyloid. Normally, the brain produces this protein as a byproduct of cellular activity and clears it away, primarily during deep sleep, through a system called the glymphatic system. In Alzheimer's disease, this clearance process fails. Beta amyloid accumulates between neurons, forming plaques that disrupt communication between brain cells. Think of amyloid like rust forming inside a pipe. In the early stages, you cannot see it from the outside. Everything still works. The pipe still carries water. But inside, a slow process of accumulation has been running for years. The second protein is tau. Inside neurons, tau normally stabilizes the cell's internal transport system, the tracks that carry nutrients and signals from one end of the neuron to the other. In Alzheimer's disease, tau becomes chemically altered. It detaches from the tracks and forms tangles inside the neuron. The transport system collapses. The neuron can no longer feed itself. It begins to die. The hippocampus, the brain's recording center, responsible for forming new memories, is hit first and hardest. This is why the very first symptom is almost always the same: difficulty remembering recent events. Not old memories, recent ones. The recording system is failing. New entries cannot be stored. Research published in the New England Journal of Medicine has shown that this biological process begins approximately 25 years before the first symptom appears. If you are 65 and just received a diagnosis of early Alzheimer's, the amyloid accumulation likely began in your 40s. This is why it is called a silent disease. Now here is how dementia ultimately kills you, and why it is so different from almost every other terminal illness. Dementia does not kill you directly. It does not destroy an organ the way cancer does. What it does is progressively dismantle the brain's ability to control the body. First, it takes recent memory, then language, then the ability to recognize faces, then the ability to manage daily tasks, then coordination of movement, then the ability to swallow safely, then control of breathing. Most people with Alzheimer's disease do not die with the words Alzheimer's disease listed as the cause of death. They die from aspiration pneumonia, food or liquid entering the lungs because the swallowing reflex has been compromised by the disease, or from infections the body can no longer fight, or from the complications of prolonged immobility. Dementia does not kill you in months. It kills you in years, sometimes a decade, sometimes two, and every year it takes something else. Let's walk through what the next 7 to 10 years look like, from early diagnosis to death. One important note before we begin: these timelines vary enormously. Some people with Alzheimer's live for 3 years after diagnosis. Some live for 20. What follows is a representative arc, not a prediction for any individual person. Years 1 and 2, the early stage. You have just been diagnosed. The neurologist has started you on a cholinesterase inhibitor, a medication that cannot stop the disease, but may slow its progression for a period of time in some people. You take it every day. You tell yourself it is working. From the outside, your life looks largely normal. You still live at home. You still recognize everyone you love. You still have conversations, tell stories, make plans. You can still drive, though your family is starting to pay quiet attention. But you know. You know because the forgetting is not random noise, and it is not improving. You forget what you had for breakfast. You forget appointments you made yesterday. You lose the thread of a sentence in the middle of saying it. You call your daughter by the wrong name and feel the cold flash of panic before recovering. You carry a notepad everywhere now. You set reminders on your phone for things you would once have held in your head without thought. You rehearse conversations before you have them, so the words are ready. You are managing. But managing takes everything you have. The emotional reality of this stage is underestimated by almost everyone outside it. You are aware, completely aware. You know exactly what is happening to you, and you know where it is going. The grief is not in the future. It is right now, in every moment you watch yourself lose another thread. The fear is not the forgetting. The fear is the knowing that you are forgetting. Years 2 to 4. The middle stage begins. The medications are still being taken. They are helping less. The forgetting is deeper now. You begin to lose not just recent events, but significant personal history. You forget the name of the town where you grew up. You forget that your mother died 20 years ago. You call out for her sometimes, and you have to be told again that she is gone. Each time the grief is fresh, because the memory of her death does not hold. You grieve her over and over, each time as though it is new. You need help now with things that were once automatic. Getting dressed in the morning has become a multi-step problem you cannot reliably solve alone. Bathing requires guidance. Managing your medications is no longer possible without supervision. You wander sometimes at night. You wake at 2 in the morning, convinced you need to go somewhere, to work, to your childhood home, somewhere. Your spouse finds you at the front door in your pajamas. This is not confusion in the ordinary sense. Your brain has retrieved a memory from decades ago and placed it in the present with full conviction. In your reality, you are not confused at all. You simply need to get somewhere. And there is something else that most families are not prepared for. It is called sundowning. As the afternoon turns to evening, the confusion intensifies. The person who is calm and oriented at noon becomes agitated, distressed, and disoriented by 5 o'clock. The exact mechanism is not fully understood. What is known is that the brain's capacity to regulate and process the external world degrades further as the day progresses. Evening becomes the hardest time. Your personality has shifted. This is not subtle, and it is not who you were. You were patient and generous. Now there are days when you are suspicious of the people caring for you. You believe your belongings are being stolen. You believe people are lying to you. You cannot be argued out of it. Not because you are irrational, but because the neural circuits that would process and update that argument are no longer working reliably. Your family is experiencing something that has a name: ambiguous loss. You are still here, physically, still breathing, still eating, still present in the room. But the person they knew, the specific assembly of personality, memory, humor, and history that made you you, is disappearing in stages. They grieve you while you are still alive. There is no ceremony for this kind of grief, no date on a calendar, just a long, slow recognition that someone is leaving, piece by piece, from the inside out. Years 4 to 7, the late middle stage. You need full-time care now. Whether at home or in a memory care facility depends on your family's capacity, your needs, your finances. Either way, you are not safe alone. The memory loss has progressed to the point where you do not reliably remember your grandchildren's names. You may not know what year it is, what city you are in, how long you have been in this bed or this chair. You recognize your spouse most days. Some days you do not. On those days, when you look at their face and see only a stranger, something passes through both of you that words are not adequate to describe. Your vocabulary has narrowed. You use fewer words. Conversations are shorter. Sometimes you speak in fragments, a partial sentence that reaches no conclusion. Sometimes you repeat the same phrase for an hour without awareness that you have said it before. You are incontinent now. The brain's ability to coordinate the complex signaling required for bladder and bowel control has broken down. Your caregivers manage this with patience and dignity, but it represents the loss of a bodily autonomy most adults hold without ever considering until it is gone. Weight loss has begun. You forget to feel hungry. Sometimes you forget how to eat. You hold food in your mouth without chewing, or you cannot coordinate the movement from plate to mouth that once required no thought. Meals take time. Textures have been adjusted because swallowing is becoming unreliable. But there are still moments of clarity. They are unpredictable and they are precious. Your daughter walks into the room and you look at her and you say her name. Exactly right. And for a few minutes you are entirely yourself again. You know her. You know where you are. You know what has been happening to you. Then it is gone. And neither of you knows when the next moment like it will come, or if it will. Year 7 onward. The late stage. You are confined mostly to a bed or a wheelchair. The muscles of your legs have weakened and contracted. Getting you from bed to chair requires 2 people and careful technique. You speak rarely now. When you do, it is a sound rather than a sentence. A murmur, a syllable, an expression of something that cannot be identified as a specific word. But you respond to music. There is research showing that musical memory is stored in regions of the brain that Alzheimer's disease attacks later than the regions governing language and autobiographical memory. A person who can no longer speak their spouse's name, who cannot tell you what year it is or where they are, will sometimes still know every word of a song from 40 years ago. This is not sentiment. This is neuroscience. Your family has started playing the music you loved. Some of it reaches you. Your foot moves. Something behind your eyes changes when a particular song starts. It does not last long, but it is there. You do not recognize your children reliably. You do not always know your spouse, but you respond to gentleness. You respond to touch. You respond to a familiar voice with something, not recognition in the complete sense, but something more ancient than recognition. Something that knows the difference between safety and threat, between warmth and cold. Something remains. The swallowing has become dangerous. Dysphagia, difficulty swallowing, develops in the late stage as the brain loses its ability to coordinate the complex muscular sequence that directs food and liquid into the esophagus rather than the airway. Every meal is a managed risk. The food has been pureed. The liquids have been thickened. Your caregivers are careful and trained. Despite all of this, eventually something reaches your airway. The pneumonia develops. It is called aspiration pneumonia, and it is the most common cause of death in people with advanced dementia. Bacteria from the material that entered your lungs take hold. Your breathing becomes labored. Your oxygen levels fall. A decision was made some time ago, guided by the advance directive you wrote in the early stage, when you could still say clearly what you wanted, that at this point, the goal is comfort, not aggressive treatment. You are not in hospital. You are in your bed or in the care facility where you have been for the last 2 years. Your family is here. Your breathing becomes irregular. Longer pauses between breaths, then clusters of shallow, rapid ones, then quiet again. This is called Cheyne-Stokes breathing. It is one of the signs that the brainstem, the region governing the most fundamental automatic functions, can no longer maintain a steady rhythm. Your family is close. You take a few more breaths, then you do not. Time from diagnosis to death, 8 years and 2 months. This is the section most people come looking for, and almost nobody provides it honestly. What makes dementia different from almost every other terminal illness is that it does not take your body first. It takes you first. Your identity, your memory, your language, your relationships, and then much later, your body. That difference changes the nature of the experience entirely. In the beginning, in those first years after diagnosis, it feels like watching yourself disappear from a distance. It feels like standing at the edge of a fog that is slowly moving toward you. The center is still clear. You know who you are, where you are, what your life has been. But at the edges, things are getting unclear. And the fog is moving, and it does not stop. It feels like losing words from a language you have spoken your entire life. Not all the words. Not most of them. Just specific ones, at specific moments, in a way you cannot predict or prevent. You reach for a thought and feel it slip away before you can close your hand around it. The thought was there, and then it was not. What most people do not understand is that the suffering in early dementia is not primarily in the forgetting. It is in the knowing that you are forgetting. There is a term, anosognosia, for the loss of awareness of one's own deficits that develops in many people with Alzheimer's as the disease progresses. In the late stages, many people with dementia genuinely do not know they have it. But in the early stages, that protection is not in place. You are aware, fully, painfully aware, and watching your own mind deteriorate while remaining conscious enough to understand what is happening is a specific form of suffering that most other illnesses do not produce. Cancer patients keep their mind intact. Stroke patients often recover some function. Dementia offers neither mercy. As the years pass and the disease progresses, the awareness dims. Whether this is mercy, whether the loss of awareness of one's own loss is a relief, or simply another loss, is a question that medicine cannot answer. What we can say is that the person who fully understood what was happening to them in year 1 is not the same person experiencing year 6. The physical experience of dementia differs from cancer in one important way. Cancer is often marked by severe, escalating physical pain, chronic, grinding, relentless pain that opioids can only partially address. Dementia in the early and middle stages is not primarily a physically painful condition. Its suffering is cognitive and emotional. The grief of losing yourself, independence, your roles, your relationships, your sense of self. In the late stage, when physical complications develop, pain management becomes central. But the person who would have registered and articulated that pain in year 1 is no longer fully present in year 8. This is what is meant when people say dementia steals the person before it takes the body. Your family grieves twice. They grieve you, the you they knew, the you who remembered their names and laughed at the same jokes and knew the exact history of every scar and story long before your physical death. This grief has a name, anticipatory grief, and it is layered over years, not processed in a single loss. Then, when the body finally goes, they grieve again. And the second grief is often quieter than the first. Toward the very end, in those final days and weeks, it stops feeling like much of anything from the inside. The morphine keeps you comfortable. The people who love you are there. You do not know their names. You may not know you are in a room, in a bed, in a life that is ending. But when a hand holds yours, something in you responds. Something more fundamental than memory or language or identity remains until almost the very last moment. Something that knows it is not alone. And then, gradually, even that fades, and you are not. Let us talk about the numbers. More than 55 million people currently live with dementia worldwide. That number is projected to reach 139 million by 2050, driven by aging populations globally. Alzheimer's disease is the 7th leading cause of death globally. The average survival time after an Alzheimer's diagnosis is 4 to 8 years, but this range is wide. Some people live 3 years, some live 20. Age at diagnosis, overall health, and the specific type of dementia all affect the individual trajectory. 1 in 3 seniors dies with Alzheimer's or another dementia, and this is the number that carries the most weight. The vast majority of the 55 million people currently living with dementia were diagnosed after the disease had already been building for years, often for decades, during which time the biology was still responsive to lifestyle intervention. The window to act is almost always earlier than we think. Now here is what does not get said loudly enough. And unlike most things in this space, the reason it does not get said loudly enough is partly because it cannot be monetized. The 2024 Lancet Commission concluded that approximately 45% of dementia cases worldwide are potentially preventable through addressing 14 specific modifiable risk factors. Those factors include incomplete early education, untreated hearing loss, high blood pressure in midlife, obesity, excessive alcohol use, traumatic brain injury, physical inactivity, air pollution, smoking, depression, social isolation, diabetes, untreated vision loss, and high LDL cholesterol. None of those require a prescription. Pharmaceutical companies have spent decades and billions of dollars developing drugs designed to treat Alzheimer's disease once it has developed. The most recent high-profile effort, a drug designed to clear amyloid from the brain, had its post-marketing trial discontinued in the United States in 2024 due to limited clinical benefit and significant costs. Meanwhile, the lifestyle evidence sits in peer-reviewed journals, available to anyone, rarely discussed in the 15-minute medical appointments where most people encounter their doctor. Walking 30 minutes a day has been shown in multiple studies to preserve hippocampal volume in adults over 60. Getting a hearing aid when you need one reduces your risk of cognitive decline by measurable amounts. A 2023 Lancet trial found a 48% reduction in cognitive decline in high-risk older adults who used hearing aids. Sleep quality affects how efficiently the glymphatic system clears amyloid from the brain each night. Every hour of chronic short sleep is not just tiredness. It is a reduction in the brain's overnight waste clearance cycle. Social connection stimulates the prefrontal cortex and hippocampus in ways that no solitary activity can replicate. The brain is a social organ. Isolation is not just loneliness. It is a neurological risk factor. This information is in the research. What has been missing is someone to say it clearly, without selling you anything, and without softening it into meaninglessness. That is what this channel exists to do. Here is what I want you to take from this video. If you or someone you love is experiencing early memory changes, repeating questions, getting lost in familiar places, struggling with tasks that once came easily, personality changes that are new and unexplained, do not wait. The difference between a diagnosis at the early stage and a diagnosis at the late stage is not simply the number of years you have. It is the quality of those years. It is the time to have conversations while you still fully can. It is the time to write the advance directive while your voice is fully yours. It is the time to address lifestyle factors that the research shows can slow progression. It is the time to spend the clear years as clearly as possible. If you have no symptoms, if you are watching this because you are 63 years old and you want to understand what you are trying to prevent, the 2024 Lancet Commission says you have real and documented power over this through the choices you make right now, today, about sleep, physical activity, blood pressure, hearing health, and social connection. The biology of Alzheimer's disease begins 25 years before the first symptom. The window to act is not after the diagnosis. It is now. Do not be the person sitting across from a neurologist, being told you have early Alzheimer's disease, thinking, I noticed something was different 2 years ago. I should have come sooner. Go to a doctor. Ask for a MOCA, a Montreal Cognitive Assessment, as a cognitive baseline. Ask for a blood panel that includes B12, thyroid function, and HbA1c. Have the conversation you have been finding reasons to postpone, because the alternative is not abstract. The alternative is a 7 to 10 year process in which you lose yourself in stages, your words, your recognition of faces, your sense of where you are, while the people who love you watch and grieve and hold your hand as something more ancient than memory recognizes that it is not alone. That is what dying from dementia feels like. Go to a doctor, get the baseline, make the choices that are still in your hands. Like and subscribe if this gave you something to act on. Share it with someone who needs to hear it. Because the most preventable deaths in this disease are the ones that happen in people who never knew there was something they could have done. One final thing, as this channel always says at the end of every video. Dr. Mannu Jones is an AI-assisted health educator. Every claim in this video is sourced from published, peer-reviewed research, including the 2024 Lancet Commission, the Alzheimer's Association 2025 Facts and Figures, research published in the New England Journal of Medicine and the Lancet Neurology, and foundational neuroscience research on Alzheimer's disease pathology. This video is for educational purposes only and is not intended to replace medical advice. If you have concerns about your cognitive health or that of someone you love, please speak with a qualified healthcare professional.